This is Megan Lee, and I'm going to be talking about fibrocystic breast disease or fibrocystic breast changes. Fibrocystic breast disease is a condition in which several benign cysts or fibrous lumps form in the breasts. Women often describe their breasts as feeling lumpy or having rope-like lumps in their breasts. These changes are associated with the hormonal fluctuations that are in conjunction with the menstrual cycle, and these symptoms typically worsen right before the onset of their period. Because of the development of these benign masses and the thickening of the breast tissues, detection of malignancies within breast tissues can sometimes be more difficult. So that's why self-breast exams for women, all women, is very important, but especially women with fibrocystic breast disease, because it's important for them to know what their breast consistency is typically like, what their breasts normally feel like. As far as people that are at risk for fibrocystic breast disease, nearly half or a little bit over half of all women will have some problems with fibrocystic breast changes at some point during their life. Women ages 20 to 50 are typically affected by fibrocystic breast disease, and typically postmenopausal women do not have issues with fibrocystic breast disease unless they are on some type of hormonal replacement therapies. 3 key things that you want to talk with your patient about when you're working them up for this disease is: do they notice tenderness, pain, swelling in one or both of their breasts? Do they notice lumps or thickening in their tissues of their breasts in one or both breasts? And do the lumps come and go with their cycle? That's a really important question to ask. In some cases, women may report a type of green or brown non-bloody discharge that leaks without stimulation or pressure from their nipples. 3 major exam components that you want to look at when working someone up for fibrocystic breast disease is: 1, you want to do a thorough clinical breast exam. So making sure that with their, anytime they complain of breast pain or with their yearly exams, you are doing a thorough breast exam regardless of family history or anything like that with breast cancer, fibrocystic breast disease, whatever the case may be. Mammograms are important, especially for one with a family history of breast disease or someone who has recurrent issues with cysts or masses in their breasts. But this can be done to help determine, to create a more accurate depiction of the breast tissue. And then ultrasounds following the mammograms to distinguish that normal breast tissue from abnormal breast tissue and malignancies. There are other diagnostics that can be done to help solidify your diagnosis of fibrocystic breast changes or fibrocystic breast disease. In extreme circumstances, fine needle aspiration to pull the fluid out of those cysts or breast biopsies. Your most common treatments for fibrocystic breast disease is really just going to be pain relief measures. So your over-the-counter pain medications like ibuprofen, your Advil, your Tylenol, encouraging these patients to wear well-fitted, supportive bras, especially when they are experiencing the pain. If it comes, with menstruation, right leading up to menstruation, just making sure that they're providing themselves with good support to help with pain relief measures. They can use warm, cold compresses for pain relief. And again, in extreme circumstances, fluids can be aspirated from the cyst through fine needle aspiration, or a surgeon can go in and excise the fibrous cysts if necessary. Your main teaching components with this disease are going to be to limit caffeine intake. Women who have high intake of caffeine are the ones that wake up and have 3 cups of coffee in the morning and drink a Coke throughout the day, or whatever that their caffeine addiction may be. Diets high in caffeine increase the symptoms, increase the pain, and can cause more fibrous tissue to form. Also, limiting fat intake, making dietary changes to limit the amount of fat that they're taking in will help decrease the pain and discomfort associated with this disease. But then also, like I touched on at the beginning of this video, just making sure that women are performing breast exams every single month. A lot of people say, pick your birthday. So for instance, my birthday is the 6th. And every single month on the 6th day of the month, you do your self-breast exam, and as needed, especially for women that have fibrocystic breast changes, to determine, okay, is this a new area? Is this thicker than normal? Is it continuous worsening pain that's persisting past, completion of your cycle? Because typically the cysts are going to shrink in size and the symptoms will kind of relieve themselves following your cycle. So just making sure that women are doing their self-breast exams, not just women with this disease, but especially women with this disease, so they know what their normals are, and so that they are able to say, hey, this is different, this is something that needs to be checked out. So thanks, I hope this was helpful.